The most common thing that people know about cognitive disorders is dementias. And dementia have different reasons. The most common type of neurodegenerative dementia is Alzheimer. So we, in our clinic, we try to establish that specialty care, and we try to build a program around this specific condition, because the care is different than many other neurological disorders. The care for patients who have dementia, in particular Alzheimer, extend beyond disease management. It's actually the dementia itself has impact on the family, and the community, and the career of the person, financial and safety. So it shouldn't be simply based on medication that I gave you and you go home. So we try to build that comprehensive care, and its process as the system has been evolving. Our clinic have been evolving with that. Part of the changes that we have been implemented this year is to introduce support group. This support group, based on this understanding that the impact of the dementia is not on the individual alone, there is impact on the family member, in particular the caregivers. There is enough evidence that the most common type of caregivers are family members, usually a son, a daughter, or spouse. And it has a significant impact on their financials, in their psychological well-being, in their own anxiety, and thinking about the future. During the clinical visit, when someone goes to a neurologist or cognitive neurologist to assess this type of situations, there is time limitations. There are questions that are appropriate for that setting that usually related to that is in specific individual that the doctor is seeing, the patient. But when you go to support group, you can ask freely other type of question related to you as a caregiver. And that's what we thought is very important to be part of the care spectrum that we offer and provide at CAMC. Dementia is part of cognitive issues. We call them cognitive spectrum disorders. So the dementia is one step in changes that happens to the brain, and it's usually start as some forgetfulness or difficulty coming up with words or finding things or executing certain tasks that were easy in the past. And then it progressed to impact the independence of the individual. And they start having difficulty keeping up with their medications, appointment, finances, driving, and so on. And at that stage, usually family member steps up and try to help. And because it's progressive, the need keep growing. And at one point, the individual that provide that care might become overwhelmed, and there is a phenomenon called burnout. And to avoid this burnout, it's very important to anticipate it. Don't wait for it to happen and then try to treat it, because at that time it becomes another medical condition, because many of the caregivers can become vulnerable and susceptible to anxiety, depression, and other issues. So we try to intervene in that stage to help the caregiver recognize what can be done and how it can be done, and when to recruit support, and what are the resources or sources of that type of support. And we try to navigate that process together.